I was asked to deliver a short message on the importance of having sound and modern cancer policy and the need for solid, state-of-the-art cancer control on many fronts. There is little data available about cancer in Greece. The WHO Regional Office for Europe covers 53 countries, and we have cancer incidence data for all of them except 5, Greece being one of them. So I will first outline the importance of good data. Without good data, one cannot assess where cancer priorities lie, and one cannot measure if actions in prevention or in improving early detection and treatment have any effect. One cannot assess the quality of screening programs and the quality of the care patients receive. This is why cancer registries are so important. Cancer registries need to be given the resources to collect population-based data and produce figures about incidence of new cases, their stage at diagnosis, and their survival. These data should be disaggregated by age, sex, region, and socioeconomic strata and made available to all, including patient organizations and ideally WHO and IARC, in order to allow standardized comparisons to be made. Indeed, this very talk that I am making would not have been possible if countries did not produce and share cancer data. This is a prerequisite to the development of a sound cancer control plan. Comprehensive cancer control consists of prevention, early diagnosis and screening, treatment, palliative care, and survivorship care. All should be part of strong national cancer control plans. WHO has produced comprehensive cancer control guidance to help countries develop and implement such plans to protect people from the onset of cancer and to treat those needing care. According to WHO estimates, cancer mortality has increased by 16% between 2000 and 2015 in Greece. This is above the average of the WHO European region, which is 6.6%. During the same period, countries such as Belarus, Czech Republic, Denmark, Israel, Tajikistan, Turkmenistan, and the UK have managed to reduce cancer mortality, showing that it is not an unrealistic aim. Indeed, mortality reduction reached up to 16% in Luxembourg and 11% in Norway and Turkey. Investments in prevention pay off and can have a major impact. For example, between 2000 and 2012, cancer incidence increased by more than 30% in 17 countries of the European region, while some other countries managed to keep it under control or even to reduce it, showing the impact of prevention measures. Primary prevention is not the only way to control cancer. Ensuring early detection and effective treatment are also crucial. Turkey is a good example of the positive impact better management can have. While cancer incidence almost tripled between 2000 and 2010, cancer mortality decreased by 16% thanks to earlier diagnosis and better treatment. This year on World Cancer Day, WHO is releasing a guide on early detection of cancer, notably the implementation of early diagnosis programs. There are two distinct strategies to ensure early detection of cancer. Early diagnosis, which aims at identifying symptomatic cancer cases at the earliest possible stage, and screening, which aims at identifying cancer before symptoms appear in apparently healthy individuals. The new WHO guide helps health planners to understand the difference between these two strategies, their relevance to particular cancer types, system requirements, impact, cost, and consequences in order to implement them effectively. In the European region, there is a tendency to invest in screening before ensuring that early diagnosis programs are in place and fully effective. This guide explains why this is not a cost-effective approach and how the absence of solid bases for diagnosis and treatment can seriously impair the effort invested in screening. Even with very limited resources, there are possibilities to improve the organization, efficiency, and quality of diagnosis and treatment services, and by decreasing the proportion of advanced cancer cases which require heavy and costly treatment, this is expected to result in resource savings. Delayed cancer diagnosis and inability to access treatment result in countless lost lives and increased disabilities. The response must be oriented around building comprehensive health systems, prioritizing high-impact and cost-sensitive interventions. A cancer death is a tragedy to family and community. By developing effective cancer control programs to prevent, diagnose early, and treat cancer effectively, lives can be saved and the personal, societal, and economic costs of cancer care reduced. Thank you for listening. I wish you a productive meeting and a successful commemoration of World Cancer Day.